how do you treat migraines holistically?
Question is, how do you treat migraines holistically? And migraines, the cause of migraines is generally a pressure difference in the blood that's going to the brain. And so there are a number of muscles that can impinge upon the arteries that go to the brain, and then thus they can cause a pressure difference in the brain. So you can get these tension headaches, you can get migraines as a result. And so then what is the tension coming from? Why are the muscles that are impinging on the internal carotid artery, why are they tight? And that could stem from all sorts of different biomechanical reasons. For example, you could have a problem in your core and your neck's compensating, and thus these muscles in your neck are tight, and then they're creating a blood flow problem into the brain. You could have excess stress, and that would cause you to tense in the neck, because it's a common pattern for people to hold their stresses in their shoulders and in their neck, and that could impinge upon, once again, the blood flow to the brain. And so how do we treat that? Treating the root cause of that. Treating stress involves specific exercises that are customized to the person to help them be more resilient against stress. So that's one approach. Another approach is direct treatment of the muscles that are impinging upon the internal carotid artery and the other arteries that go to the brain. And that involves identifying the muscle and then executing an active release technique, release of those muscles, which involves shortening and lengthening the muscle with tension and pressure. This is like probably the best medical but conservative treatment for muscles. And then other potential treatment avenues would include restoring strength and mobility to the neck in general. Being stuck in a posture all day puts load on certain tissues and unloads other tissues. And this undue load on muscles that shouldn't be loaded can be a long-term cause of tension and pressure on arteries that go to the brain. Now that's just one set of the causes. There are also causes that are outside of these domains. Causes like electrolyte imbalances or insufficient sodium or potassium or magnesium, and sleep in general. So like good sleep hygiene will prevent lots of migraines.
Can holistic treatments completely cure migraines?
Can holistic treatments completely cure migraines? I believe they can, and I've had clients who've had their migraines completely go away. Now, it doesn't necessarily treat it permanently in every case with no follow-up treatment ever. But none of the available treatments do. No single treatment for complex presentation of any kind in the body has 100% efficacy all the time. The treatment need any sort of presentation of any sort of pain, whether it be migraine, head, which is basically meninges pain in the brain, and pain somewhere else in the body, requires a specific treatment plan for that individual. I kind of went on a rant there, but the question being, can it cure it? Yes, it can. It's possible. It's not in the cards for everybody all the time, but you can definitely make things better almost all the time.
Can poor posture cause migraines?
Poor posture can cause migraines or contribute to the cause of migraines. I don't think poor posture alone would necessarily result in someone having migraines. Almost always a severe pain pattern like a migraine would be, or any sort of pain pattern, there are always multiple causes. Posture can contribute, but I don't think it alone is the answer to the migraine, is the complete answer to the migraines. That isn't to say that some people, if they fix their posture, might improve their migraine situation some, but it won't knock it out entirely, in my opinion. Okay, next question.
What role does movement therapy play in migraine relief?
This one, that's a little bit more distant from fixing migraines, but it can still nonetheless help. I think, the movements that I usually help people with in this office are, the movement pattern that people do the most is they breathe, which is a movement pattern, and they walk. And helping someone walk is can affect their structure. So if they're stuck in a posture where there's a bunch of tension through the neck because, let's say they have a hurt knee, so they tilt their shoulder as a result, then this tension here could cause a migraine. And so you want to teach them how to walk properly. The other movement pattern that is maybe more directly important to migraines is the breathing pattern. And people can get stuck into stress patterns of breathing where they don't properly use their diaphragm and their neck muscles in the right sort of ratio, generally like 2/3 expansion of the belly, 1/3 happening in the chest and a little bit in the neck. People can get stuck and become sort of neck breathers, and that could have definitely a direct effect on migraines and migraine problems. So movement pattern of breathing, very important. Movement pattern of gait, also important. But movement, or the breathing pattern being the more important of the two.
No, we also kind of did this one already, but how does stress cause migraines?
Stress causes migraines by directly creating tension in the muscles. All sort of negative human emotions create some amount of tension in the system. It doesn't always present the same, it definitely doesn't present the same way in every person. Each person has their own sort of stress-related pattern. Sometimes if their individual stress pattern coincides with the muscles that impinge upon the blood flow to the brain, then that person is more susceptible to getting migraines due to stress.